Yeah, we're back. So I'm just going to give everybody 5 minutes to join the live. So I believe a lot of people are getting notification now that the live has started. Hello, Malum H. How are you doing? Trust you are all doing great. We're just going to wait for people to join us. We're just going to wait for people to join us while we talk about infertility. All right, let's keep coming. We're just waiting for others to join us. If you are joining this live, all you have to do is to double tap and like the video. Double tap on your screen. It automatically likes the video. And if you are coming across this YouTube channel for the first time, my name is Mercy Mary. I am a registered nurse and also a registered midwife. So if you've not subscribed to our YouTube channel, kindly subscribe to our YouTube channel. On our YouTube channel, we talk about health. We talk about your health. We talked about how you were doing. Those questions you are very shy to ask your doctor, you can ask us here. Those questions that your doctors don't have the time, they don't have enough time to talk about it with you, we can also talk about it with you. But a big disclaimer, for your personalized health care, for your personalized health, I will advise you to speak with the doctor to get useful guidance and also to get useful help from your doctor. This is more or less like a general advice, and this is more or less like a general health education, not particularly to you. So if you are watching this live section, can you drop on the comment section and let us know where you are watching from? Welcome to Nurses Lecture Room. Hello, Mulum H. How are you doing? And trust you are doing great. It's a beautiful evening over here, and thank you for joining. So if you are joining, if you're watching, kindly drop on the comment section. This is a topic for everybody. Whether you're trying to conceive, you are young, you are vibrant, you are not trying to conceive yet, this topic is for you because you are having a knowledge of infertility is going to guide you when you are trying to conceive. Okay, so I believe this video is for both the men, the women, it's for everybody. So nobody is left out when it comes to infertility. It is something that everybody should know about. All right. And if you are watching this live section right now, can you drop on the comment section, say hello, and let us know where you are watching from. If you've not subscribed to our YouTube channel, can you do so on our YouTube channel? Like I earlier said, we'll talk about health, and we try as much as possible to help you with your health. We try as much as possible to give advice as we can. All right, drop in the comment section and let us know where you are watching for. Coming across this space for the first time, my name is Mercy Mary. I am a registered nurse and also a registered midwife. So we have Sharon Casey. Sharon Casey, how are you doing? It's a beautiful evening over here. Sharon Casey is watching from Lagos State, Nigeria. She said, keep up the wonderful work. Thank you very much, Sharon Casey. I like having you on my live. Hopefully you stay to the end. All right, we're going to be talking about infertility and we're going to be taking questions from the audience. So the first thing I would like to know is, what is infertility? What is infertility? So that's the first thing I believe you want to know. So infertility is defined as the inability to get pregnant after 1 year of regular unprotected sex. We have John. John, hello, how are you doing? Trust you are doing great. We have Timothy Sakunda from South Africa. Timothy, how are you doing? And trust you are doing great. So I'm going to be going straight into the point now. Feel free to drop the comments in the comment section while I explain. So like I earlier said, infertility is defined as the inability to get pregnant after 1 year of regular unprotected sex. That simply means that for the past 1 year, you've been having regular sex, you've been having unprotected sex, you have not been able to conceive. All right. But if you are more than 35 years of age, if you have been trying to conceive for the past 6 months with regular unprotected sex, we can say there is also infertility. But if you are less than 35 years, you are expected to try that for 1 year. If there is no show, then we cannot diagnose infertility. Then if you are above 35, you have to try for 6 months. And if there is no show, you can say, okay, there's an issue of infertility. So for you to say somebody is having infertility issues, you don't just try for the first 1 month, 2 months, 3 months of having regular unprotected sex and there is no children or there's no thing to show for it, and you say you are infertile. No, you have to try for more than a year. You have to try for 1 year before you say, oh, I think I'm having fertility issues, I need to see the fertility expert. So this thing called infertility can affect both men and women. And this may cause a wide range of this may be caused by a wide range of physical, hormonal, genetic, and environmental factors. So there are different causes of infertility, which we are going to be discussing in this video. That is why I said this particular video is for everybody, because once you know the cause of a thing, you prevent it when you know you are going to be conceiving in the future. You will avoid it when you know you want to get pregnant. Sometimes there are some lifestyle, there's some things we do, we don't know that it impacts our fertility. So we're going to be talking about that on this particular video. I've already talked about infertility. It simply means you've been trying for a year and it's not coming. And if you are above 35 years, it simply means that you've been trying for 6 months and there's nothing to show for it. So then that takes us to the different types of infertility. So there are basically two types of infertility. That's two definitions, two branches generally of infertility from my own point of view. So we have the primary infertility and we have the secondary infertility. For the primary infertility, this occur when a person or couple has never conceived before, despite trying for at least a year. So that is when we say this person has primary infertility. That means these couples, they've never conceived at all. They've never given birth to any child at all. We say, oh, this person has primary infertility. But if a couple has given birth to kids before, they have one or more successful pregnancy before, and they are trying again, it's not working, then we say this particular individual has secondary infertility. The difference between primary infertility and secondary infertility is that in primary, they've never had any successful pregnancy. They've never gotten pregnant before. But in secondary infertility, they've had one or two kids before. They've had one or two successful pregnancy before. But all of a sudden, they cannot give birth to children despite trying for over a year or over 6 months. So if you don't know the different types, I believe I have been able to explain for you the difference between primary infertility and secondary infertility. There's also something called unexplained infertility. Unexplained infertility. When we say unexplained infertility, it simply means that all the tests have been done. They've checked the man's semen. They've analyzed the man's semen. The man's semen is okay. The sperm count is okay. The shape of the sperm is okay. Everything is intact. They've done all the necessary tests on the woman. The fallopian tube is okay. The ovaries are okay. The hormones are okay. But yet, they are not getting pregnant. So that is when the doctor will say, madam, oga, you have unexplained infertility, because they've checked everything. Both couples are doing great. Both couples are fine when it comes to their reproductive health, but they are not getting pregnant. So that is where the name unexplained infertility is coming from, because the cause of their fertility is not known. So remember, we have the primary infertility, we have the secondary infertility, and we also have the unexplained infertility. Unexplained infertility is one of the most frustrating types of infertility, I would say. Why do I say that? I'm saying unexplained infertility is frustrating in the sense that they don't even know what is causing the problem. You know, when you know something like this is what is causing the problem, oh, there's a low sperm count, there's an issue with the fallopian tube, there's an issue with this, that is good. But in unexplained infertility, you can't really pinpoint what is causing this infertility. You can't really pinpoint if this is causing the infertility. Nothing has been like dashed out that this is what is causing the infertility. So that is why that is called unexplained infertility. So take note of those three types of infertility. But let me now break it now, because we have two people involved. We have the male and the female. So I'm going to say in another angle, we have the male infertility and the female infertility. So most times when you see couples trying to conceive, you hear things like that. My wife never get belle. My wife is not pregnant yet. I don't know why she is not pregnant. It ought to be words like we have been trying to conceive, because it's a man and a woman thing. We have been trying to conceive, but it's not working. Not my wife has been trying to conceive. I think those words needs to be rephrased. We have been trying to conceive. We have been trying to have a baby, but it's not working. There should be nothing like my wife is trying to conceive. She's not pregnant yet. I don't know why. It should be we have been trying to conceive. We've tried everything, but it's not working. We don't know why. Because it's a two-party thing, both the man and the woman. Because even if the woman has in abundance plenty of egg, and there's something wrong with the man's semen, the woman is never going to get pregnant. If the man's semen is intact, everything is fine, and there is something wrong with the woman's egg, they are not going to get pregnant. Okay, so that's why I now decided to talk about male infertility and female infertility. Male can contribute to infertility due to conditions like low sperm counts. Yes, I think in yesterday we talked about causes of watery sperm on our live section. Another live section, we also talked about what causes low sperm count and what causes that watery sperm. So if your husband is having watery sperm and you are not getting pregnant, it's advisable for you to tell your husband to see the doctor for semen analysis. Low sperm count in men can contribute to infertility. Poor sperm mobility. For example, the sperms are there. The sperm is okay, but the sperm are not moving. If the sperm are not moving, that means the sperm is not going to get to the destination. So that's a problem. That's already causing infertility. Abnormal sperm shape. If the sperm doesn't have that usual shape, there's an abnormality. The sperm are not likely going to break into the egg. They are going to find it difficult to even get into the egg. So abnormal sperm shape can actually result in infertility. And also hormonal imbalance. Most times when we hear hormonal imbalance, we feel it's just a woman thing. No, men also battle with hormonal imbalance. It is not just a woman thing. Men battle with hormonal imbalance. They will also have something called the blockages. If the vas deferens is like a tube that transfers sperm from where it is being produced to where it's going to mix up with the semen. So if there is blockage in the vas deferens, it's going to be difficult for the sperm to get to the egg, and that can result in infertility. So these are some causes of male infertility. Let's talk about the female side now. What causes infertility? Why are women finding it difficult to get pregnant? Some of the causes in the women's side, the number one that is common that I've talked about on my YouTube channel is actually PCOS, which is polycystic ovary syndrome. PCOS, polycystic ovary syndrome, is one of the causes of female infertility. Blocked fallopian tube. Because for pregnancy to take place, the egg has to travel through the fallopian tube. So if the fallopian tube is blocked, if there is no fallopian tube, that can result in infertility. They will also have what we call uterine abnormalities. When I say uterine abnormalities, let me break it down. This is like a womb, the womb abnormalities. When you hear abnormalities, see, it simply means something is not right. So when something is not right in the womb, when something is not right in the uterus, then that can result in infertility. For example, polyps, for example, fibroid. They will also have premature ovarian insufficiency. This can actually result in female infertility. All right. So I think we should take note of that. I've talked about the male causes and also the female causes. So we're going to be talking about the general causes now of infertility. If you are following, let me know in the comment section. Just let me know, yes, I am following. tell me to continue, and we're going to be talking about causes and how to deal with infertility. Then at the end, I'm going to be explaining why pregnancy is not just about sex. Pregnancy is more than sex. A lot of things are going to be taking place in your body for pregnancy to actually take place. So if you are following this content, if you are following this live section, kindly let me know in the comment section that you are following. Say hi in the comment section and tell me to continue. So we have a question from Joseph. I think, Joseph, I answered your question in that previous live I came before. So you said, yes, I understood about the causes of miscarriage, Ma. Thanks a lot. I miscarried 4 times. So all 4 times were embryo abnormality. Is it possible? It is possible. And with that miscarriage 4 times, I will also advise you speak with a doctor. Check about rhesus factor. You have to check about that rhesus factor, because if you have miscarriage and you have rhesus issues, I think you should see the doctor and tell them they should check your blood and also see if there is a rhesus incompatibility in regards to that. Okay, so God's Gift Uzoma said, yeah. Harry Chebe said, hi. Okay, so we are going to continue now on the various causes of infertility. So we talked about the types. We've talked about the male infertility. We've talked about the female infertility. What causes them? We've talked about it. So now we're going to be talking about the common causes, like the general causes. So the first one I'm going to be talking about is age. Yes. Is Ishoma Gift. Hello, how are you doing? The first thing we're going to be talking about age. Age also plays a role when it comes to fertility. Age plays a role when it comes to fertility. So for women that are above the age of 35, the egg quality and quantity is also being affected too. So when you are above 35, that's why they say if you're above 35 and you've been trying for the past 6 months, baby is not coming, it's advisable for you to see the fertility expert as soon as possible. Then the other common cause of infertility is hormonal imbalance. Like I earlier said, hormonal imbalance does not affect the women alone, it also affects the men. So hormonal imbalance is one of the causes of infertility. Smoking, alcohol, drug abuse, drug use, all these can affect fertility. If you are trying to conceive, try as much as possible to check any medications you are taking, even the one prescribed by the doctors. So I have a friend that has been trying to conceive, but she was on some antihypertensive medication that was not enabling her conceive. But immediately she stopped that antihypertensive medication because she went to go and meet the doctor and tell the doctor that I have been trying to conceive. What could be the cause? And they found out that why she was not getting pregnant was because of the antihypertensive medication, that's hypertension drugs that she's taking. That is why she is not getting pregnant. So while you are trying to conceive, try as much as possible to avoid drugs, especially when you don't need it. Even as low as paracetamol. Yes, if you don't need it, don't take it. Ibuprofen, if you don't need it, don't take it. Right? Because as a woman, these drugs tend to alter your cycles. They tend to alter your cycle. So smoking, alcohol, and drug use can cause infertility. Excess weight or underweight, it's not just obesity that causes infertility. If you are underweight, it can also impact on your fertility. Stress, chronic stress can impact on your fertility. Stress can affect your sperm quality. So I think that's something we should take note of. STIs, sexually transmitted infection. Sexually transmitted infection can affect fertility. Then also genetic disorders can affect fertility. So these are the common causes. Personally, I will advise, if your plan is to get pregnant soonest, if you are smoking, you are drinking, you are on drugs, I don't mean drugs that are beneficial to your health. You know what I mean? Like you're abusing drugs, you're taking hard drugs, try as much as possible to stay away from them. Try as much as possible to do away with them, because this has impact in your fertility. Okay, before I go into what to do if you are struggling with infertility, let me know in the comment section if I should continue. And if you have any question in what we've discussed so far, kindly drop in the comment section. We've talked about what infertility really is. We've talked about the types of infertility. And we've also talked about the causes of infertility in male and female. And we talked about the general causes of infertility. So if you have a question, drop in the comment section. I am willing and ready to answer your questions. Okay. And if you are coming across this channel for the first time, my name is Mercy Mary. I'm a registered nurse midwife, and all I do is to answer your health questions and tell you to meet with your doctor. Okay. And also, if you've not double tapped to like this particular video, can you double tap the screen if you've learned from this video and like the video? So we have a question. It said, I've done all the tests, including HSG scan test, and hormonal profile, yet pregnancy is not coming. So, Harry Chebe, what do I advise? In such a situation, what I advise, like I earlier said in the beginning of this video, is not just about you. It's about you and your partner. You've done the tests. Has your partner done semen analysis? So I know like where I am from, like they see it abusive when you tell them to go for semen analysis. If there's a way you can approach the matter to your partner. Okay, she said, my partner is okay. Do you have a regular cycle? Harry Chebe, do you have a regular cycle? Do you have a regular cycle? Do you know your ovulation date? That's the day your body releases egg. Are you aware of the day your body releases egg? How many days cycle do you have? Are you sure you're aware of it? Because if you know your cycle, you're having a regular cycle, that is actually a stepping stone. You're able to track down your ovulation. The next thing is to make sure that your partner is around to have sex with you during that period. And if you've been doing all that, it's not working, then we can suspect unexplained infertility. Like I said in this particular video, unexplained infertility can really be frustrating and annoying in the sense that you don't really know what is causing it and you don't know how to tackle it, despite everything seems okay between you and your partner. So what I would advise you to do is to speak with a fertility expert. They might decide to stimulate your eggs stimulate your body to release more eggs. All right. So I would advise you to speak with a fertility expert, like a gynecologist, a doctor. Let them help out. So Harry said, I know my cycle because I mostly used to have cramps during my ovulation windows. Do you have discharges? How long have you been trying to conceive? How long have you been trying to get pregnant? Are you taking any medications as we speak? Are you on any medications? I'm not talking about medications for getting pregnant. Are you on any medications? Are you taking all these agbo? Like, there are some people that take a lot of herbal medications because they're trying to get pregnant. Agbo, clove water, they take agbo, clove water, they take a lot of things. And all these things tends to alter cycles. So you've been trying to conceive for 2 years. That's a long period. That's a long period. I'm not on any medications. 2 years. How many days cycle do you have? How many days cycle do you have? I really want to know. And also, have you seen a doctor in regards to this? Have you seen any doctor in regards to this? Have you seen any doctor in regards to this? And also, how many days cycles do you have? So we have Olamide. Olamide, hi, how are you doing? Osemudiame, good evening. Bethel, I saw you last on our live yesterday. I think so. Then Harry Chebe said 27 to 30 days interval. That's a regular cycle. That's a normal cycle. And you said your partner is okay because you are sure your partner has done some semen analysis. Okay, this is my general take. This is my general advice I'm going to give to you now. You are not on any medications. Okay, let me finish Harry Chebe's questions. Okay, you are not on any medication. You are not taking any medications. You are not taking any concussions at the moment. And your cycle is regular. good and fine. So what I would advise you and your partner to do as at now, since you've tried everything, is to try to eat healthy, prepare smoothie. I talk about the benefit of making smoothies yesterday, because these smoothies, they contain a lot of vitamins. If you can get bananas, spinach, blend them together, banana, spinach, nuts, like it could be walnuts, avocado nuts, groundnuts, be blending these fruits together. They're generally healthy for your body. You can actually give that a try. And also, if you've not seen a fertility expert, a fertility specialist, I'm not talking about just go to any hospital and see any doctor. I'm talking about fertility experts, fertility specialists, those that deal with women, those that deal with fertility, getting pregnant. If you've not seen them, I would advise you book an appointment with them and have a one-to-one conversation with them. You get, because the earlier you do this, the better. Okay, the earlier you see a fertility expert, the better. You don't have to wait for 3 years, 4 years. So immediately you've tried, now you said you've been trying for 2 years and it's not working. What I would advise you to do is to see a fertility specialist. Since you know your cycle, you've tried having sex on your cycle, your partner's semen is okay, see a fertility expert. Probably they are going to give you some supplements. They might give you some injections to help your body release more eggs. So that's what I will advise you to do. Yeah, that's my personal advice. Don't wait till you're 35. This is my advice for you. See a fertility specialist. That's my advice. See a fertility specialist. Try to eat healthy. Avoid any unnecessary medications, which you said you are not on. Avoid any medications at all, including your partner. And make a lot of smoothies, healthy smoothies, blend fruits, vegetables, nuts. Give it to your partner and also give it to yourself. You take it daily and see how it goes. So that's going to be my personal advice for you in regards to that. And I hope it worked, and I wish you all the very best in your trying to conceive journey. So we have Odimegu Chidima said, I had stillbirth last year on June 19 at 31 weeks. My baby had a condition called ophalocele. I was told to try again after 3 months. I started trying since October last year, but no positive results. We did all the tests last 2 months and the doc certified us okay. I have a regular cycle, 28, sometimes 27, other times 26 cycle lengths. Okay, let me answer Chidima. Chidima, the doctor certified you are both okay, which is good. Since the doctor said you are fine, that's a good sign. So what I would advise you to do is, I know they usually advise you when trying to conceive, you should have sex frequently, which is very much advisable. So from the look of things, your ovulation date is going to be day 14, like day 12, 13, 14. Day 11, 12, 13, 14 from your cycle, if you understand how your cycle work. So day 11, 12, 13, 14, you should be thinking about your ovulation during that period. So what I would advise you to do, if during your menses, that period, no sex, a day or two after your menses, no sex, so that your husband is able to build a thicker sperm. You understand? So the sperm is not watery. So give your husband this time before your ovulation, no sexual intercourse. Let's see how it goes. Probably that helps. So give him that time of no sex. Give him that time for his body to replenish the sex, to replenish the sperm. Then have sex between that your fertile window. Have sex during that your fertile window and see how it goes. And like I always say, the benefits of good food, healthy diet cannot be overemphasized. Bananas, walnuts, spinach, some salmon or mackerel fish, which is popularly called Titus fish. Those ones are very rich. You can also have them in your food and see how it goes. Okra is also rich. Yam is rich for women, because there is a particular community, there's a particular community known as Igbo Ora. They are known for giving birth to twins. their Yoruba community that is close to Lagos, Igbora. They are known for giving birth to twins, and we heard that they eat a lot of yam and they eat a lot of okra. You can add that as part of your diet and see. Chidima said, I am a healthy eater. Has your husband done semen analysis? And also, how long have you been trying? I think, yeah, that's what I want. How long have you been trying? Has he done semen analysis? So Chika Ezewan said, is there any specialist in today's hospitals in Lagos as it regards to this matter? I and my partner have visited Ikorodu General Hospital, but results, I think that question is not complete. I think that question, if Chika can complete the question. I will appreciate if is it Chika completes her question. There's gonna be, if you can't get it in the general hospital, I would advise you try some private hospitals. I know there are some private hospitals in Lagos that actually help with all these fertility. They have fertility experts. Their major role is actually about giving birth. So they have ideas about maternal and child health. So I think you should try, if the general hospitals are not working, then try the private settings and see how it goes. So Betel Osemudi Ahmed said estradiol of 31 gram per liter. Okay. See, most of these figures, they are actually determined. We can't really say they are okay or not. They're actually determined by your age. Age usually plays a role before they will tell you if it's okay. It actually varies with age and also your menstrual cycle. What phase of your menstrual cycle are you? So that's going to do what phase of your menstrual cycle are you when you did it, and also how old are you? All this plays a role to determine if this is okay or not. So what I advise you to do better if you are trying to conceive is to actually speak with your doctor to walk around with your age and also the phase you are in your menstrual cycle. Though I don't have an idea of the accurate estradiol that's supposed to be. Oh, Chidima said I'm a healthy eater. That's also good. You can also encourage your husband to also be a healthy eater. That's cool. That's good, Chidima. We've been trying for 8 months. Okay. So what I would advise you, you've been trying for 8 months, keep on trying, avoid unnecessary, like what I said to Chebe, keep on trying, avoid unnecessary medications. During this period, since you have a regular cycle, avoid any concussions like clove water, those agbo they used to take in the streets. Like avoid any concussion as soon as possible, because I know, like most times when we are trying to conceive, our parents are looking out for us. They tend to like think about, oh, if you use this mixture, it's going to help flush your system and make the baby come out. If you use it, they start giving you different concussion to try to help you conceive. What I would advise you to do is to stay away for the now, away from such concussion, so that your body regains its normal phase and see how it goes while eating healthy and also preparing smoothie to help with your husband sperm. So instead of taking soda, instead of taking sugary things, why not take smoothies in replacement? That's my personal advice to you, Chidima, and I hope it helps. So Stab said, thanks a lot, ma. You advised me to do resource blood tests for curriculum. I have O plus resource positive and my husband is same. Is it normal? O plus, it's normal as far both of you are not negative. Yeah. I think as far both of you are not, one is like, as far both of you are not negative, that's okay. But if as a woman, you've had an abortion or you've had a miscarriage before for somebody else that is negative, that can also play a role. I don't know if I'm making any sense. So I think you should speak with your doctor to that. If you've had like a negative there has been positive is okay. It's okay. Yes, he has done some semen analysis. We have been trying for, okay, I've answered that one. Please, can you recommend one? What in particular are we recommending for? So I don't. Okay, fertility specialist. There's one nurse. Is it nurse Amarachi? There's one doctor. Is it Doctor Amarachi? He works at a fertility hospital in Lagos. I'll try and see if I can contact her. Please, what I can do, I'll send an email across to the doctor. Then let me just screenshot. Then I'll see if we can have a screenshot. I'll send an email across to the doctor. She is a fertility specialist, she's a fertility expert. I'll send an email across to her and wait for her feedback. Probably in one of my life, I will let you know if I get feedback from her or not. Or I'll send her an email and see. Because personally, I am not a fertility expert. Again, I'm a nurse helping you out with what I know, and also based on personal experience as a mom. But I am not a fertility expert. So I'm going to speak to Dr. Amarachi and see how it goes. I'm going to send her an email, send one or two doctors that are fertility related. I'll send them an email and we'll see what we can do about it. No, you cannot store a smoothie in a cooler. You cannot store a smoothie. Just make it. It's something you can make instantly and drink. It's something you can just make instantly and drink. Put it in a water bottle. Personally, I was not liking smoothies. So how I was able to make my smoothies that I just blend them, put it in like this water bottle that you can easily sip. Like you just sip it as if you are drinking little water, not this normal water bottle. Those water bottles that have straw in them. Yeah, Dr. Amarachi. I will send her an email and see how it goes. I'll send her. Have you spoken with her before, Sharon Casey? Christy Douglas said, I have a what? I'm just going to see if I can get her email. I was trying to, let me see if I can get her email now and send her, because I think a lot of people need help. And if we can do something to actually help out, that is going to go a long way to help. Let me see if I can come across her. All right, feel free to drop your questions in the comment section while I walk around what to do. But what I would advise you to do is to turn on that notification bell. Okay, I also follow her. Okay, what I would advise you to do is to turn on that notification bell. Turn on that notification bell. That's what I would advise you personally to do, just in case I have something in stock for you in regards to that, so you can have like a fertility expert to speak with. I think we have to get more fertility experts into the space so that people are able to know what to do and get useful help as much as they can. So I will see what I can do to get a fertility expert to help out. So that's what I can promise for the now. So just if you've not subscribed, kindly subscribe. And if you've not turned on that notification button, kindly turn on the notification button. So we have a question on the comment section. Christine Douglas, I am bothered. My period came on the 3rd of June. I'm not seeing it for July. There are lots of factors that can affect your period. Like stress can affect your period. Stress can affect your period. Medications can affect your period. pregnancy can affect your period. So you can do a pregnancy test if you actually know you had sex during that period. Sometimes our periods are delayed from environmental factors. So what I would advise you to do today is July. What's today's date? July 10th. What is your normal cycle? That's one thing you should take note of. And how many days late are you? So it doesn't really matter if it's coming on the third day of June every month. You have to know your cycle and know how many days cycle are you and how many days late is your period. I don't know, Douglas, did you get that question? Douglas, let me know if you get it. So Beta said, what is the normal, what is the level, sorry, what is the level of AMH to get pregnant naturally? That should be between 1 to 3. So if you have 1.9, 2, 3, it should be 1 to 3. Some school of thought will tell you 1 to 4, some school of thought will tell you 1 to 3. So that is normal. But all these factors, the doctors are usually going to analyze your age. You get, it's between 1 to 3, yes, but your age is going to determine the actual range that will work perfectly for you individually. Okay, I don't know if I'm making sense better. So we have Ishama gift. Is there anything that can be done concerning a man with 0% sperm count? I think the first thing that should be done is to find out why the man is having 0% sperm count. Is the vas difference blocked? Is it a hormonal problem? Is it the fact that there is no enough testosterone? Are the testicles functional? You have to find out the cause. Because once you find out the cause, it's much easier to sort it out. For the man to have 0% sperm count, then you have to narrow it down to what is actually causing it. That is where the doctors come into play. That is where the semen, the analysis, they are trying to, like, the general body test come into play. So you can't just say a man have 0% sperm count without actually pinpointing if there's any cause around it. There could be something causing it, why that sperm is 0%. And while trying to find out the sperm, having a healthy lifestyle is going to go a long way to help. Like quitting smoking, alcohol, eating healthy, veggies, fruits is going to go a long way to help. And also food rich in zinc, omega-3 fatty acid, all these are going to help. So that's what I advise. The first thing I would advise the person to do is actually to find out what is actually causing that 0% sperm count. So Christine Douglas said 28 days cycle, 10 days late. If you know you had sex, why don't you do a pregnancy test first? If you've had sex during the period, do a pregnancy test and see how it goes, except you are not sexually active. So if you are sexually active, I would advise you to do a pregnancy test. That's the first thing I would advise you to do. So Bethel said, what is the normal level of AMH? I've answered that question, Bethel. Bethel, you've asked this question again. I've answered it. I said the normal is between 1 to 3. But most doctors are going to consider a lot of factors when determining if it is okay. And that is, they're going to determine your age. They're going to put your age into consideration when doing that. So above 30 years of age, the figures are going to be different, but the normal is usually between 1 to 3. .09, well, I think that's 1.09. That is okay, because like I earlier said, the number is between 1 to 3. That should be okay. Better. That should be okay. The colleagues Ezemoye said, please, what are the necessary scans and tests one can do? Why the reason for not ovulating? You can do an abdominal scan. Yeah, you can do an abdomen. Sorry, let me just, I need to charge this one. You can do an abdominal scan. The doctors can advise you do some blood tests to check for your hormonal profile. They want to check your hormones. All these things are what the doctors are going to check. They'll use scan to check if there is PCOS, that's polycystic ovary syndrome. They will also do some blood, to take some blood samples to analyze your blood. So that's it. So Beta said, thanks very much. Ihioma Gift said, thank you. Saba Joseph said, thanks for everything, ma. You're welcome. So like earlier said, I'm just giving a general advice. I'm giving a general advice, but for personalized health, like in terms of fertility, advise you speak with your doctor face to face. You speak with a fertility expert face to face. That's going to go a long way to help. So Christy Douglas said the lines on the test was not bright. One is faded, other is bright. If one is faded and the other is bright, that could be a sign of pregnancy, just that it's not obvious yet. So what I would advise you to do, Christine Douglas, is to use your early morning urine. Do another test, use your early morning urine. Do another test, use early morning urine. But that's when you wake up, the first urine you actually do. Why it's advisable you use early morning urine? Because you've not drank a lot of water, it's not diluted. So I would advise you to do another test and use early morning urine, because from the what you said it's two lines. One is faded and the other is bright. So if one is faded and the other is bright, it's a bit dicey. I don't know if I'm making sense. So that is a sign that you're pregnant, but it's not showing yet. But calm down, do another test tomorrow morning if you still have some extra strips, and see how it goes. So that's my advice, Christine. Let me know if you get that. All right. So if you know I've answered your questions, why haven't you liked the video? All you just have to do is to double tap the screen and like the video. And also, if you are watching us for the first time, you are coming across this channel for the first time, you've not seen my face before, this is the first time you are coming across Nurses Lecture Room. My name is Mercy Mary. I'm a registered nurse and also member UK YouTube Health. On this my channel, we talk about health. We talk about fertility. We talk about your sexual and reproductive health. If you've not subscribed, do well to subscribe and also turn on the notification button so you don't miss out whenever we upload a new video. So if you have any question, kindly let me know in the comment section. If there's a particular thing we didn't talk about, kindly let me know in the comment section so we get it sorted out. So if you are struggling with infertility, one of the things I advise is for you to consult a fertility expert as soon as possible. Don't even waste time. Don't start saying, oh, I have to continue. No, if you've been trying, consult a fertility expert as soon as possible. Track your cycles. For those that know their cycle, good and fine. Track your cycle. Adopt a fertility-friendly lifestyle. Eat balanced diet, whole food diet, exercise regularly, but not excessively, because when you exercise too much, it's still not good. So you exercise regularly, then also quit smoking, alcohol, try as much as possible to manage your stress through mindfulness or therapy. Then get medical tests. It could be blood tests, semen analysis, and also ultrasound. Then explore different treatment options that will be provided by the doctors. So your doctors are going to be providing you with different treatment options. It all depends on what you are portraying or what you are surfacing at that particular moment. They might give you medications that will stimulate ovulation, medications that will stimulate your ovaries to release egg. They might tell you to use your intrauterine insemination. They might tell you for IVF, depending on how severe it is. They might tell you to do some surgery to correct some things. If there's issues with the fallopian tube, if there's issue with any of the things, they might tell you to use that. If there's issue with your sperm, there's issue with your egg, they might provide options with donations of egg and also sperm. So they are going to provide you with different options. But if you've been trying, if you are less than 35 years, you've been trying for the past 1 year, see the fertility expert. And also, if you are less than, if you are less than 35 years, you've been trying for 1 year, see the fertility expert. But if you are more than 35 years and you've been trying for 6 months, see the fertility expert. Don't wait till 1 year. So that's my general advice. So Chika said, my wife is not over 18. Is it ovulating you want to write? Is it ovulating, Chika, you wanted to write? And if you say your wife is not ovulating, why do you feel your wife is not ovulating? One of the signs that your wife is ovulating is actually seeing her menses. If your wife is seeing her menses every month and it is regular, there is a higher chance that she's ovulating. Because one of the obvious signs that the woman is ovulating is actually her menses. So if your wife is seeing her menses every month and it is regular, then she's ovulating. There's a higher chance that she's ovulating, that she doesn't have issues. But there could be something somewhere that might be wrong that you people might need to see a fertility expert. So if there is no more question, and my life is going to be ending in the next 9 minutes. And if you've not double tapped to like this particular live, please, what are you waiting for? If you've not double tapped to like this particular live, please and please, what have you been waiting for? Yeah, if she sees her menses every month, that's she's ovulating. All you just have to do is to track the ovulation. Olamide said, Ma, please, how can summer stop heavy period with blood clot caused by tiny fibroid? You have heavy period with blood clots caused by tiny fibroid. My advice is for you to speak with your doctor. That's my advice. Because you already said you know the cause of the blood clots. And the cause of the blood clots is actually tiny fibroid. Generally, tiny fibroids might not be harmful. Just that the period is going to be giving you some kind of discomfort. It's not going to make you like feel comfortable because you're always changing your pad. You're always not comfortable whenever you're on a period. That might be like one of the concerns. But one thing I would advise you is to see your doctor and ask for personalized advice in regards to that. Nifemi Adeola said, is it normal to have a missed period at least once a year? You can miss your period. Your period can be delayed. When you say missed period, does it mean for the full month? Like you didn't see your period at all for the last, let's say 30 something days, 40 days, you didn't see your period. Is that what you're trying to say? Is that what you're trying to say? Chika said, sorry, menstruation. Yeah, I get what you're saying. I knew you were talking about menstruation. Yes, if your wife is menstruating, there's a higher chance, a very, very high chance that she's ovulating. All you have to do is to know her cycle and track down her ovulation. Sometimes, like I earlier said, stress can be a cause of that missed period. The medication you are taking can be the result, can be the cause of that missed period. So if it just happened once in a year, you are not pregnant. For me, as far you are not coming down with some various signs and symptoms, you are not bleeding heavily, you are not having pain, you are not having abnormal discharges, then it's fine. But if there are other symptoms following that missed period, that once in a year, then you should see the doctor. But if it just happened once in a year, then for me, it's not something to be worried about, because environmental factors can actually make you delay your menses. And if you are on some medications, even malaria can actually delay your menses by 10 days. Yeah. Personally, I remember when I had malaria, I was on malaria drugs. I didn't see my period throughout a particular, for example, I didn't see my period throughout the period of August. Then I started seeing it in September. So I wasn't really worried because there are no other signs and symptoms. I was not portraying any signs and symptoms. I was fine. It was just that particular time I was treating malaria that I missed my period. It came late. Not that it didn't come at all. It came late. So it's okay. Chika said, please, how can I track down her ovulation? Okay, to help track down her ovulation, you have to know the start date of her menses for 3 months. For example, we're in the month of July. To be able to know her ovulation, you have to know the start date, the day her menses started, the date her menses started in the month of April, May, and June. You have to put it in the calendar, and that's the starting point. From there, we will be able to help her calculate her ovulation and also know her cycle. I don't know if that makes sense, Chika. So so that's that. I think Upgraded actually deleted the message. If there's no question, I will be going off in the next 3 to 4 minutes. I'll be going offline in the next 3 to 4 minutes. I've tried for today. So we have Upgraded Muslima said, age 31, single, weight 47 kilogram. Is that kilogram? LH, luteinizing hormone. That's LH. LH, I think it should be luteinizing hormone. TSH is thyroid stimulating hormone. FSH is follicle stimulating hormone. Yeah, TSH is thyroid stimulating hormone. FSH is follicle stimulating hormone, 17 point something. Prolactin is 26. Regular cycle test was taken on the 14th. What it indicates? See, personally, I don't know the average in my brain. Yeah, I don't know the actual figures of this test results. I don't know it in my brain. I don't really know I don't want to give estimated figures and it's wrong. All right, probably you can send me a message on IG and I will check and let you know if it indicates something else. But if you are speaking with your doctor, they should be able to tell you if everything is fine and if everything is okay. So that's what I will say. Upgraded Muslima. Chika said, thank you very much. Nifemi said, thank you so much, Ma. You are welcome. So, Upgraded Muslima, that's what I have to say in regards to your question. Then if you are watching this live and you've not double tapped to like the video, what are you waiting for? If you are watching this live for the first time and you have not subscribed to my YouTube channel, kindly do so now. Send me a message on Instagram and I'm going to tell you how to book an appointment. Instagram, Nurses Lecture Room. That's just the name on Instagram. Same name here is the same name on Instagram, Nurses Lecture Room. Just that nurses _ lecture _ room. Wow, it's almost 11 o'clock. I need to go. If you have regular cycle, I think if you have regular cycle as a lady, that's the sign that you're ovulating. To me, if you have a regular cycle as a lady, you see your menses, like you know, I have 28 days cycle, I have 30 days cycle. That's perfect. That's a sign. There's a higher chance, a very high chance that you're ovulating. Because if you are not ovulating, there's a very slim chance that you're going to have a regular cycle, that you're going to be seeing your menses. So for you to be like seeing your menses, it simply means that you're ovulating. Oluwa Bumi Dada. Good evening, Mrs. Good evening, Oluwa. How are you doing? Upgraded Muslim has said, but low blood flow. How many days does the blood last? How many days do you see your menses? Because sometimes we don't expect the blood to be like very, very heavy when it's coming out. So some people see their menses for 2 days, and that is okay. As low as 2 days, that is okay. While some see their menses for 7 days, that's fine. Anything less than 2 days is a problem. You need to see a doctor. Anything more than 7 days is a problem. You need to see a doctor. Chika said, thank you for the day. You are good. Thank you very much, Chika. I'll try and see if I can get some fertility experts on the YouTube channel. I'll try and see if we could get some fertility expert on the YouTube channel. So Ogre said 2 or 3 days, then spot it. That's fine. Like I earlier said, 2 days menses is okay. The normal menses should last between 2 to 7 days. If it is less than 2 days, see a doctor. If it is more than 7 days, see a doctor. And if you have your cycles between 27, 28, 29, that is perfect. That is okay. You don't need to worry. You don't need to be disturbed. Okay? I think that should be fine. It's fine. Your normal menses 2 to 7 days. I repeat, if it's less than 2 days, see a doctor. And if it's more than 7 days, also see a doctor. So from what you said, everything should be fine. So we've done for today. Thank you everybody for joining our live section today. So before I go, let me just, if you have anything you want us to discuss tomorrow on our live section, let me know in the comment section. If there's a particular topic you actually want us to talk about tomorrow, let me know in the particular comment section. Brownish spotting is okay. Brown blood at the end of your menses is perfect. It's just like some old blogs that are coming and oxidations are taking place. So it's okay. It's okay to see that brown spotting. So it's not something of concern. All right. It's okay. It's okay to see the brown blood. Please and please, if there's any particular thing you want me to talk about tomorrow on my live section, kindly let me know in the comment section. So Vero Kwashi said, hello nurse, my menses was coming and everything was okay until I finished writing my exams and it did not come again. Your menses was coming and everything was okay. How many days late? How many days late now, Vero? How many days has your menses been late? When was it supposed to come? When were you expecting it before? Why did it not come? What dates were you expecting to see your menses before? I'm supposed to go offline. I'm waiting for Vero. Please and please, if you are coming across this channel for the first time, you've not subscribed, kindly do so. And if you've not watched any of our video, kindly check out. There are some videos I'm going to be taking out of my channel, and this is because I did a voiceover. I actually prefer my videos when my face is showing and when I'm teaching. So I'm thinking of removing all the videos that I did voiceovers for and just oral like I normally do and teach like I normally do. Okay. For a month. When was the last period? When was the last period? Sunday. I greet you. I greet you too, Sunday. Akosha said, hi, hello, how are you doing? You are late. Why are you coming late? But thank you for joining. Vero, when last did you see your messages? When was the last day you saw your messages? I want to know the last day so I can check. Upgraders Muslim says, subscribe. Someone said I have hormonal imbalance, but talking to you, I get relaxed because no visible symptoms occur. You are okay. Like I earlier said, for those figures you dropped, I wouldn't be able to pinpoint if it is above or below. So what I would advise you to do, you can see the doctor or you can compare figures. To make it much easier, you can compare figures online, but see the doctor if you are worried. For me, your cycle is okay. That's perfect. Your cycles are perfect. You don't have any symptoms. You are seeing your period for 3 days. The rest are spotting, which is normal. So that's what I have to say in regards to that. So that's okay. You have people that see their cycles 30, 32 days cycle, and their menses last for 7 days. Why some? They just last for 2 days. After 2 days, there's no single spotting. There's no single discharge. You understand? So Akosua said hi. Hello, Akosua. How are you doing? So if there's any particular topic you would like us to discuss in our live tomorrow, kindly drop in the comment section before I end the live. So I'm giving everybody 4 minutes. If there's something interesting you would like us to talk about tomorrow, kindly drop on the live section. Feel free to subscribe, okay? So Upgraded Muslima said, thank you. Live longer, keep growing. Thank you very much, Upgraded Muslima. So we have a Vero May. He said the last one ended in May. Ended. When did it start? The last one, when did it start? Not the day it ended. When did it start? So it started in May, June, July. Vera, I would advise you just see the doctor. Yeah, that's my personal advice. Because if you're having regular cycle now, because you said the 14th and it's almost 2 months, you've not seen your period. So I would advise you see the doctor. That's my personal advice to you, Vera. Just see the doctor. And also, what I notice sometimes in some hospitals, they just put general doctors. When you are going to see a doctor in regards to your reproductive health, make sure you are seeing the right doctors. Yet, because some doctors are general doctors, some doctors are ear doctor, we have eye doctor, we have GI doctors, we have heart doctor, we have lungs doctor. So make sure you see the doctors that are talking about women. So May was the last time you saw your menses. June 10th, you didn't see your menses. And today is July 10th. That's like 2 months now. So I would advise you to see the doctor. That's what I would personally advise you to do. Sonny said, I would like us to discuss prevention and treatment in greater details. Prevention and treatment of what? Prevention and treatment of what in particular, Sunday? Let me know. Prevention and treatment of what do you want us to discuss about? You're welcome, Vero. Nice having you on my live. If you are watching this live and you've not subscribed, you've not liked the video. To like the video, it's very easy. Just double tap the screen and it automatically likes the video. No stress. Okay? That's how to like the video. Then, if you've not subscribed, go to my YouTube channel. Just click on the subscribe button. Turn on that notification bell. There's a notification bell there. Turn it on just in case I pop on my any live section, you get instant notification. All right. So Sunday said we should talk about prevention and treatment in greater details, but I'm asking what exactly what prevention and treatment are you talking about? What prevention and treatment are you actually talking about? Because I want to end the live now. I've tried for today, so it's going to be another section tomorrow. I need to get some sleep. Attention. Sunday, I'm waiting for you. I'll just wait for like 1 minute. If you don't finish, I'm going to end the live, please. Then tomorrow, you're going to get another interesting topic. Trust me to always bring interesting topics to your table. Okay? But I prefer you people giving me topics generally. It shows what is bothering you and what I need to discuss. Attention, not if you know. So Sunday, if you're not completing it, I'm going to end the live in 3, 2, 1. All right, thank you everybody for joining our live section today. It's been an amazing section. It's been engaging, it's been interacting, and I am glad I was able to answer your question. See you in our next live section tomorrow. Bye everyone. Bye. Don't miss me too much.